It's not just a condition of 35-year-old women who've not had a baby. This can affect women who've had babies, it can affect young girls of 20, 25 in exactly the same way as older women. So I think it's important that they know that women and pain, endometriosis is a possibility.
It took from sort of 18 through to my early 30s before I actually knew what it was.
Well, for me, it took 4 years before I was diagnosed.
Of course, I'll have my down days where I just won't feel very good emotionally. And that's not just from medications, it's because I'm learning to cope with something that has changed the entire focus of my life.
The first point is that it's usually extremely frustrating because the patients have usually been seen by a series of health professionals previously. Their treatments have usually been either ineffective or only partially effective. And the number of treatments which are available are limited. And because of these reasons, and usually because of the longevity of the problems, it's a very frustrating condition to deal with.
If endometriosis is a frustrating condition for the medical profession to deal with, just think how frustrating it is for the woman living with it. It's a disease that can affect virtually every area of her life, her sexuality, her work, her fertility, and therefore not surprisingly her self-esteem. Of course, every woman's experience of the disease is different, but are there ways in which doctors and other health professionals can help a woman live better with endometriosis? A first step would be to acknowledge the impact of the disease.
Firstly, important to remember that 70% of women now go out to work, either part-time or full-time. That many studies have shown that the issue of menstruation, pain or volume of the loss, is a potential source of acute embarrassment to women. So you have on the one hand the simple concern about something wrong with the periods. The second point you have is chronic pain, and chronic pain is something which saps on a regular basis the emotional and social perception of an individual, and which is extremely uncomfortable. One can imagine how that is made worse when maybe partners, maybe health professionals of some sort diminish the impact of that symptomatology on the patient's lifestyle. The women with pain usually have tried other methods, several methods of treatment. Some standard medicines, some alternative medicines, some bizarre and some less bizarre. But they are usually at the end of their tether in terms of the excruciating pain which they feel either during the cycle or particularly at their periods. And these are the group of women whose whole lifestyle is being, probably not too strong a point to say, destroyed. Every month is a trouble. The periods are usually very painful and uncomfortable, and their professional and other life is basically grossly interfered with.
That view is shared by the women who have to live with endometriosis.
Well, I work in the dealing room of a bank. I sit in front of a lot of different computer screens and telephones, a lot of mainly men who I'm not likely to turn around and say, I've got period pains today and I haven't even got my period, you know. So it's a lot of marketing, it's a lot of maths work, it's a lot of using the computer, and it's handling sums of money that, you know, go into £50 million. If I'm not feeling well and I make a mistake, I'll lose my job anyway through non-performance. Now I lose it not so much because I'm not performing when I'm there, but actually because I can't even get there to perform.
I was told that I couldn't close the post office if it was just my period or I had tummy ache or backache, and they couldn't possibly send a relief down. And I really felt guilty that if I had permission to close the post office, that my customers wouldn't be able to, the old age pensioners wouldn't be able to get their pensions or whatever.
It is reduced to what it was like 10 years ago, but there still is pain that you still have to cope with it. If you've got a mortgage to pay, you've got to carry on going out to work. If you live by yourself, you've still got to cope with life in general. And to tell someone, well, it's minimal, you know, what are you making the fuss about? You know, your confidence just goes way down.
But I think in some ways it's actually worse for the onlooker, because I mean you've got the insecurity of not knowing, and you know the helplessness and the guilt, and you think that you should be doing something, and God knows what that be. But it certainly has affected our sex life, in as much as you can't really be spontaneous, because I mean you don't want to cause pain, or you don't want to sort of. And when somebody's in pain, you can't really relate to them that way. Neither can she. To me, I suppose, obviously, you know. So.
When I did finally find out what it was, you know, that was a relief at first, until you start finding out about it and find that there isn't really necessarily any cure for it, other than the menopause itself. And that started all a different train of thought, which is more about the depth of the relationship, really, about whether you can actually sustain a relationship with somebody who's going to be very ill a lot of the time. Happily, I've come through it. I think it would have helped me if I'd had some counselling from somebody to understand the actual implications of endometriosis.
Certainly, yes, at times when sex has been painful. I think both of us felt extreme strains on our relationships at that time, partly because it was unclear, I think, about whether it was I'm rejecting you because I don't like you or I'm not attracted to you anymore, rather than because I'm in pain. And I think however much one says, this hurts, and that's the reason, it's very, very difficult for people to hear just that message and not take on lots of others that might be about feelings of rejection.
You start going out with a person, and then comes like the week when you're feeling ill and you don't really want to go out and you just want to stay at home and crawl into bed and die, sort of thing, you know. So therefore it puts them off and they don't phone you up and ask you out again.
The other thing is do you say something when you start going out with somebody and it gets towards the bedroom situation and you're just thinking, do I say something now? Do I wait till it hurts and say something then? Do I just try and not say something and just pretend it didn't hurt? And you know, it's so difficult to know what to do and to know how to explain it to anybody in a time when you're starting a relationship.
Relationships, social life, work, all of them affected by endometriosis. So what are the ways in which the management of this disease can be made more effective? Women attending gynecology clinics often complain of lack of time, lack of information, and little or no continuity, a different doctor every time. At Addenbrooke's Hospital in Cambridge, Professor Stephen Smith, who sees many tertiary referrals, has developed a different approach.
We felt very early on that it was very important to spend time in explanation. In infertility and particularly chronic pain, and most particularly in endometriosis. It is the time spent with the professionals, allowing the woman to discuss her views, how it affects her, how the treatments may interfere or otherwise with her ordinary life. That requires time, and we have a system whereby each woman or couple has a minimum of 30 minutes with a senior doctor in the clinic.
What do you actually understand?
We are fortunate here because of our research interests to have research nurses who are specifically studying endometriosis, and all of the research nurses take part in our general endocrine clinic in which we see endometriotic patients, and they are encouraged and are part of the team, as it were, in dealing with the endometriosis. So we are fortunate in having research funds to provide for nurses who are able to spend that extra time with the patient to discuss their problems and the treatments which we offer the patients. And we feel that that extra investment in time is better on the patient's behalf, and actually from a purely efficiency point of view, it actually reduces the number of times that women wish to come back to the clinic, because they will have seen somebody who has previous fairly extensive experience of endometriosis and will have had some sort of definitive time to work out their problems with that doctor.
Feeling in control of treatment choices is important because a woman with endometriosis can feel very vulnerable. Not only does the disease affect key areas of her everyday life, it can also result in low self-esteem.
That was perhaps one of the most devastating things about having endometriosis, that I spent some time really feeling less than a full woman. My whole sense of femininity seemed to disappear. It's come back now, and I almost don't know how. but certainly I can remember a real feeling of despair around that, a real feeling of I can't be a good wife or partner or even friend.
I went through a time where I didn't bother wearing makeup, didn't care about what I looked like, and really resented being a woman, really, because, you know, if I hadn't been a woman I wouldn't have endometriosis. So I did, you know, the same sort of thing where I just didn't bother looking after myself and didn't care what I looked like or anything. But you do gradually come out of it. I don't know how you do it, but it's sort of just a gradual process.
So, in conclusion, what would the women who live with endometriosis like their medical advisors to consider? Primarily, it's a sense of being regarded as a partner in their own treatment. And perhaps that could be achieved by more time.
Being given the time to ask all the questions that you want to ask. I mean, I do all the things I'm meant to do. I write down questions. You get through 2, and they have to apologise profusely because they have a waiting room full of... I mean, you've sat there with a waiting room full of people for 2 hours before you go in there. And then you get to see them for such a short time.
More continuity.
One of the problems when you don't see the same person is you feel you're being thrown around and you're not being given proper treatment because they don't know any of your medical history, and they spend most of your appointment sitting there flicking through all your notes, asking questions.
You see a different person, as Pam said, they're flicking through your notes to try and sort of get a quick history of you. And then they ask you the same questions that were asked by the other person you saw 3 months previously. And you spend most of your appointment time repeating what you had said in previous appointments.
More information.
I think if you don't have information, you haven't got choices. If you don't know what can happen to you, when it starts happening, the stress is a lot worse. And it's ridiculous telling a woman she's neurotic. That she's going to develop symptoms just because she's told about them.
Going on from that, surely the person that knows my lifestyle best is me and not the doctor. Therefore, with his help, working alongside each other, one can work out which drugs and the side effects of those drugs are going to affect your life, your lifestyle.
More recognition.
A lot of the time it feels as though endometriosis is treated, it's almost like it's sort of a minor thing like a headache or something. Take a few pills and go away, and then it does go away and you're supposed to forget about it. But actually the experience of living with it is a bit like that of living with a disability. And given that we're all supposed to treat people differently nowadays who have disabilities and try and see that in fact they're just as entitled to live full and complete lives as anyone else, I really do feel we've been given a bit of a hard deal in terms of the disease that we have.
I didn't create this illness. It came to me. I don't want it, but I'll learn to live with it. I just want honesty. I want somebody to treat me as an adult, which I am, as a person with a brain, intelligence, emotions, and actually a life that I adore. There's some fantastic things about my life. This is the one bad thing about it. And unfortunately it detracts from the quality of all the things I've ever enjoyed and still enjoy.
I always like the term consultant. I know that consultant isn't publicly these days necessarily top of the political league, but the word is a very important word. A doctor functions as a consultant, and he's a consultant to a patient, not a consultant over or above the patient, but a consultant with the patient. And the whole point of a half-hour session is to allow consultation, to allow discussion between the woman and the consultant as to what is the disease, how are the symptoms related to the disease, and what treatments are available. And that aspect of consultation is crucially important. We never say, look, there is one way of dealing with it and this is the treatment. We offer the patient a range of treatments from medical through to surgical approaches, and then the woman herself, usually with a partner, can discuss and decide which treatment she wants. In reality in medicine, it's very seldom that there is a treatment which is the only treatment. There are certain circumstances that that's the case, but usually there's a range of options which the patient should be offered and discussed, and then come to a decision herself.